Hey, Dr. C, how you doing today? Thank you for joining me. Today we're going to talk about hoarding. Hoarding. I remember back when I was going to the Shrewsbury Senior Center and all, we had what's called a triad, which included the police, the EMTs, and who are the primary people who see these sort of things. And the senior center, of course. And every now and then you'd hear a kind of a terrible story about an apartment that they walked into, which was just an absolute disaster. And so, but nobody knew what to do about it. That was the problem. Now we have learned a lot more, still not totally up to date yet on the treatment plan and all, but we know more about hoarding now. In fact, hoarding used to be part of OCD. That was the mental disorder. So it was OCD, hoarding, basically. But nowadays, too, it has hoarding in itself has been classified as an independent mental disorder, and it's included in the book that lists all the mental disorders. So we are making some progress in that. So let's talk a little bit about hoarding. Obviously, it has to have a definition, which again is not totally done yet, you might say. But basically, there's a persistent difficulty in parting with possessions. That's part of the definition. There's the acquisition part. Why and what do you accumulate? What are the things that you're hoarding? Number two, why aren't you getting rid of it? Number three, is it affecting your life in any way? And number four, what sort of a problem do you have if you have to give it away or sell it or whatever? How do you get rid of it? What does it do to you? So there's a tremendous inkling, you might say, on the part of the hoarder to never want to give away a damn thing, especially the stuff that they're hoarding. So all those things enter into the whole disorder, the hoarding disorder. Now, when you look at numbers, it's not a huge number of people. Probably they estimate about 2% of the people in the United States are hoarders. That's a small number. I've seen numbers up to 6% of people who are hoarders. That may be a little more accurate. A little more. So let's look at it a little bit more. There are certain things that you look for with a hoarder. Number one, what's their personality like? So in other words, if you talk to a hoarder, it doesn't take long for you to understand their basic personality on acquiring, excessively keeping, and have difficulty mentally giving away or reducing your clutter. So their personality. And their personality basically has to do a lot with executive functioning. We've talked about executive functioning in that prefrontal part of the brain. That's the part that deals with organizing things and making decisions based on the material that's coming in, and then acting on that, making might say executive orders, that type of thing. So you can make that decision on the personality of the hoarder by simply talking to them for a very brief amount of time. Okay. There's almost always a family history of hoarding. Not always, but probably about 70-80% of them have another hoarder in the family. Now, did that have anything to do with that particular person? Not known totally yet. A lot of the people, unfortunately, are seniors. Why a predilection for seniors? When the classic case, I'll describe the classic case for you, but why so many seniors? Well, because a lot of the seniors have gone through some trauma in their life. Significant trauma, enough to cause some PTSD. In other words, there is some depression involved with the seniors who have that hoarding disorder. So, they may also have OCD as well, but it's the hoarding disorder that seems to be the most obvious of all of the things. So, let's talk a little bit about the staging. And yep, we like to organize, and you can organize hoarding into stages. 5 stages, believe it or not. I've said all the time that the less we know about something, the greater the amount of material that's published. And that has to do with hoarding as well. So there's 5 stages. Number 1, there are clues. People as young as in their teens can be potential bad hoarders in the future. They may be people who do excessive shopping, buying things that they don't really need and storing them at the house. They may have a chronic anxiety disorder if they lose any of the materials. They know what's in the house. And when something disappears, all hell breaks loose. Their anxiety peaks. Where did that go? He or she must have stolen it. Oh yes, that's all part, early stage of the hoarding disorder. Number 1, starts in the teenage years, the classic. Stage 2, cluttering stage. They keep acquiring a particular thing or acquiring several different things. No room to put it. They stack it up here. They stack it up there. But their stacks have not yet gotten to the point where it interferes with their living yet. Now, the house may be dirty, but all of their acquired clutter is still put into spots that don't interfere with their living. Now, they also are not quick at fixing appliances or fixing a lot of things as well. So that may be a part of stage 2. Stage 3, the clutter has gone up tremendously in stage 3. Very, very obvious. Now it's in places where it shouldn't be. It's in stairways. It's in hallways, so you have to get around everything. And it's not in good repair. May start to get some odor in the house because they're not repairing it, they're not fixing it, they're not cleaning it. So now we begin to see odor. You may even start to see some rodents come into that house because of the clutter. Okay, that's stage 3. At this stage, the people may also, the the actual person who hoards may avoid a lot of people coming into the house. They're embarrassed, and they should be. So that's also a part of stage 3. Stage 4, you now begin to get mildew, the black type mildew because of the clutter. You may get increase in that odor, increase in what some of the rodents have done, chewing up some things. You may also get some problems with the house itself. In other words, it now is almost uninhabitable. Okay, that's stage 4. Stage 5, it's a condemned house. You do not want to live in it. You can't sleep in the bed because all of the clutter is extended onto the bed. The bedding is terrible, it's odorous. All of these things are part of stage 5. Now, I'm not yet talking about people who hoard animals. You read every now and then about somebody who keeps 100 cats or 100 dogs, or usually it's cats, but they're keeping loads of animals, and the animals are running amok in the house. Their feces are everywhere. Their urine is everywhere. That's a special form of hoarding with animals. And it is the same disorder. But we'll talk about that a little more. So, what do we do? A lot of these people have families, and the families may have been in there a number of times, and the families may or may not be very helpful for that person who's the hoarder. They may try to clean it up themselves. And what that does, especially if the hoarder doesn't realize that they're cleaning it up, they'll wonder, where did this pile go? Somebody stole it. I bet I know who, somebody in the family I know. Well, okay. But have you done any good? Have you done any therapy? You can't clean it up yourself. You can't complain to the hoarder. The hoarder doesn't see themselves as a real pathologic, a mental pathologic person. They don't see that. So you're not doing any good if you're that type of relative. Obviously, you need to have some help. So, what do we do? Okay. There are some forms of treatment out there. Unfortunately, not too many people are good therapists because they don't have the experience of treating a hoarder. And even though they may put that on their resume, they put that on their shingle, we're social workers and we do hoarding too. Well, I would look into it before I would just go and hire them to do any of the treatment. The major treatment that seems to help basically has to do with CBT. That is the controlled therapy. Okay. Let's talk about a little bit about that controlled therapy. Cognitive behavioral therapy. Now, there are some national organizations, unfortunately none around here. There are a few around here who do cognitive behavioral therapy because we use that therapy in other disorders as well. This involves multiple sessions. Usually averages out 25 to 30 sessions initially. And that's at weekly intervals. So it takes 6 months minimum to get a full evaluation and treatment plan started. So let's say that You got your 26 sessions that you are planning to do. How do they approach it? Well, number one, you talk to the individual, obviously. It doesn't take long to see what that personality is like. You look also to see what kind of a support system they have or don't have. Now you need to do a home assessment. That's very important, because not that you need to stage what stage of hoarding they're in, but obviously it helps to know what stage they're in. So you need to do a home assessment as well. So those are the two basic starts of the cognitive behavioral therapy. What else do they do? Well, first, they need to establish some sort of an organized plan. It's a very individual plan, and this is where a lot of the experience comes in. They need to know what to do and how to do it. You never blame the patient. You never yell at them. You never try to clean it yourself, because you'll be self-defeating if you do that. You talk to them about a plan. Not necessarily your plan, but here's a plan. And you talk to them about how do people organize when they buy stuff for their house and all. How do they organize it? You let the person themselves, the hoarder, say, well, what's the difference between this organized plan and this squalor that's out there? At this point, we need to also differentiate whether this patient really is a hoarder or not. He could be, or she, they're equal in numbers, male and female. Could they just be a collector who went a little overboard? There are some collectors that collect a lot of the material, but there's a difference between a collector and a hoarder. A collector is very organized, number one. Number two, the stuff, you don't want it laying in the middle of the hallway and all. You don't want to put it on the stairs where it can fall down. And when you're a collector, you organize and you keep it clean. Okay. It's possible that they could be just a collector, but by the time you get to this stage, you're probably a little more than just a plain collector. Could you just be a clutterer? Maybe you just don't have the capability of keeping stuff here. So the more you acquire, you just throw it here, throw it there. Okay. Could be just a clutterer. But generally, a clutterer has some perspective on what they're doing, and they don't go crazy when one piece of that clutter is missing. Okay. And then it could be squalor. That's basically what we're talking about, squalor. That's when you get the odor, the rodents, everything in, and you can't sleep on a bed, you can't use a couch, you can't do it because it's loaded with the squalor, with the junk that you've collected. Okay, so this is the third part then of what the cognitive behavioral therapist does. Now the behavioral therapist will move on. They got to try to motivate the hoarder then to see exactly what they're doing, and that the hoarder participates basically in the treatment plan on how to organize and how to systematically get rid of all of the material that's accumulated in the house. We try to reduce the acquisitions basically. So that is the next step, using stepwise diminution of the acquisitions. That takes a skill not only with the hoarder, but the person who is trying to guide them with their therapy. We also have mentioned that a lot of the people do have anxiety and depression, especially the depression. Maybe it's a PTSD. That has to be dealt with. You deal with that as well. And again, that's where the experience of the person who's doing the therapy, that's where their experience comes in. You recognize the fact that maybe you do have PTSD and maybe you do have to have some medication to treat it. So this isn't an individual treatment one-on-one. You may have to call in other people to help in that plan. What you do is you try to highlight whatever skills the hoarder has. Emphasize them. Use them. And so you gradually build on it over the course of each one of these sessions. Like I said, the sessions are a weekly thing, usually an hour to 2 hours at a time, going through stepwise the entire treatment plan. That doesn't mean that after the 26 weeks is up, that you're suddenly cured. No, you still have that basic personality, so you do have to follow up afterwards. You don't need the weekly sessions anymore, but you do need to reinforce all of the things that you've accomplished so far. And you have to keep at it. You have to keep at it. You have to also emphasize the important things that the hoarder was able to do and pat them on the back for what they did. I hope that during the treatment plan, you have incorporated some family members as well, because a lot of them may be totally frustrated. They may be totally frustrated because they never got anywhere, and they got blamed for anything that was missing because they didn't approach it right. So part of, the experience of the person doing the behavioral therapy is recognizing that and giving that, might take, like a caretaker, you pat that family member on the back and continue to hopefully let them take over your job in the future for follow-up. So that is cognitive behavioral therapy and a little bit of medication. Now remember I told you that hoarding used to be part of OCD. Okay. It isn't anymore. But a lot of the material that we have, all of the experience that we have we've gotten through a lot of the big international OCD foundation, because OCD's been around a long time. And so we should use whatever material they have and learn a little bit about it yourself. Okay, so that's another point for the future. It is such a problem, and unfortunately, it's difficult to find good therapists. There are a couple in the area here in Worcester area. I don't know what their credentials are. They say that they will include hoarding as part of their patient population. I don't know. It's something before you hire somebody to look into. But generally, where do you look for help? Where do you get help? Well, there are some actually international organizations. Like I said, the International OCD Foundation. I got a lot of my material from them. They put out a lot of material, and a lot of it is helpful. It is helpful. But there are some others. For example, Clutterers Anonymous. That's very similar to Alcoholic Anonymous. In other words, they follow the same steps that they do in Alcohol or Narcotics Anonymous, which means that you have to first recognize that you are a hoarder. And so you go to the meeting. Hi, I'm Dr. Claremont. I'm a hoarder. Hi, Dr. Claremont. No, you go through that meeting. That's the Clutterers Anonymous. It's a 12-step meeting. Okay? Nothing locally. You have to go to Somerville, actually. I'm sorry, Arlington. There is one in Somerville. That's it for the state. That's it. 2 of them for the Clutterers Anonymous. There is a thing called the Hoarding Project, and you can get some material from them. Again, nobody in the area is part of Hoarders Project. So that's 3 different organizations. There's also a thing called an Institute for Challenging Disorganization. Wow, that's a big word, isn't it? Challenging disorganization. Again, nobody in our area is part of that particular institute, and I wasn't able to find out a lot about it. So I guess what it amounts to is that you need to find somebody who can organize and get set up with a program to help the hoarder. And so look into the people who, and I guess most of them are masters in social work. Maybe they have that experience now. I don't know. So at any rate, that's about all I have to say about hoarding. There's a lot of material about it, but like I said, the less we know about it, the more they write about it, because there's nothing really set in treatment. This is Dr. C. Get rid of your stuff. Have a good day.